I'm Yashaswini, and you are listening to Aspic AMR podcast series. I hope you all are safe in these tough times of COVID-19 pandemic. Public health being one of the main areas of outreach. This is a time to reach out with experts' information and guidelines through our first podcast series of COVID-19 and public management. This is our first episode of COVID-19 and SARS-CoV-2 variants, focusing on what, why, and how about the variants and what does the second and first wave in the pandemic mean to us. To discuss all this, we have with us Professor Idya Karunasagar, who is Senior Director, International Relations at NITE University in Mangalore, Advisor Research and Patent, NITE University. Welcome you, sir, in this session.
Thank you.
Now, moving on to the questions. So, from the past 1.5 years, we are almost undergoing tough times due to the COVID-19 pandemic. Knowing this, it is a viral disease. So, can you distinguish between the coronavirus, novel coronavirus, and SARS-CoV-2?
Yeah. Now, maybe I'll just start with say what are viruses. Now, we know there are different types of microorganisms. We have bacteria and we have viruses, and then we have various parasites. Now, when we talk about viruses, now viruses are microorganisms that do not have a cell of their own. So they have to depend on a host. So they cannot multiply outside a cell. And interestingly, viruses can infect a whole range of organisms, starting from bacteria. So they can even infect bacteria to man. So they infect all forms of life. And interestingly, there are viruses which are living with us. Now, the studies have shown that, of course, human body, if you look at a healthy human body, we have our own human cells. And earlier it was thought that we have more bacterial cells on our body than our own cells. Of course, that is still true. But now, with the discovery of viruses, now we know that there are more viruses than even bacteria on our body. So there are a number of viruses that are living in our body. Many of them are living with the bacteria, and some of them are not causing. Of course, the bacterial viruses don't cause human disease, but other viruses can. Some of them can cause human disease. So we are living in the environment along with different types of viruses. And now this coronavirus is called so because of its appearance. Now we all heard about the corona around the sun. When we talk about eclipse, we say there is, you see a corona around the sun. So the name comes from there because this is a virus which has a crown-like appearance on the outside, which is because of the spike proteins on the outside of this virus. Now, coronaviruses have been known for quite some time, and it's not that all coronaviruses cause disease. Now, some of them even cause disease like common cold. There is a type of coronavirus called coronavirus 229E, which causes common cold. But then the importance of coronaviruses as pathogens became more serious after 2002 when we had this outbreak of the severe acute respiratory syndrome or SARS. That outbreak happened in 2002. And then it was identified that this virus came from bats, but then not directly from bat to humans, but then there was an intermediate host, a ferret. It replicated in the ferrets and then infected humans. And then unlike this present SARS-CoV-2, which is causing a big pandemic all over the world, affecting millions and millions of people and also killing so many people, this first outbreak of SARS affected only about 8,000 people, and it did not spread beyond a few countries. Of course, it also originated in China, but it was restricted to some countries in Asia And then, of course, due to movement, it also went to Canada, but it did not become a pandemic. So we just call it an epidemic. There was a spread of disease from one part to another. So there was an epidemic of SARS, affected only small number of people. Then came another virus called the MERS, that is the Middle East Respiratory Syndrome virus, which is very close to the SARS virus. And this came from camels. So it affected the countries, Middle East countries. And it caused a disease similar to the severe acute respiratory syndrome virus. Again, it was restricted to the Middle East, so it did not spread to other regions. Now, what is the difference between this SARS-CoV-2 and the other SARS-CoV? Now, of course, when this outbreak happened in China, of course, first it was reported by China to the World Health Organization. Initially, they said they found a pneumonia of unexplained origin and due to unknown cause. And then they came out with the diagnosis that this is a new coronavirus. And so that's why the terminology comes as novel coronavirus. So that is now because it was new at that time in 2019. And the disease is the coronavirus disease is abbreviated as COVID. So we call it COVID-19 because it was recorded in 2019 December now in China, and then it spread from China to other countries. Now, if you look at the SARS-CoV-2, how is it related to other viruses? Now, one thing that happened quickly was as soon as China reported the disease, they also came out with the whole genome sequence. Now, of course, the sequencing technology has improved a lot, so we can quickly sequence nucleotides of organisms. So they came out with the whole genome sequence of this virus, and it was shown to be having a RNA. Now, we know biologists know that the genetic information is contained in our cells in DNA. DNA, but most of the actions in a cell takes place through proteins. So, but then how the information goes from DNA to protein is through this ribonucleic acid. We call it messenger RNA, and we call this process of converting DNA to RNA, RNA to protein as the central dogma of molecular biology. So all the organisms which have cells have DNA in their nucleus, so their genetic information is contained in this DNA, and then it's converted to RNA and protein. But viruses are unique in that they do not contain both DNA as well as RNA. They may contain either DNA or RNA. Now, this SARS-CoV virus belongs to a group of RNA viruses. So, the genetic information is contained in RNA. And this RNA, now, when we talk about RNA, we say, okay, RNA is the one which is involved in protein synthesis. So, normally in a cell, when the DNA is transcribed to an RNA, then RNA binds to the ribosome and proteins are produced. So, this RNA of this virus is in a form in which it can directly bind to the ribosome in a cell and produce protein. That's why we call it positive strand RNA virus. And then once the sequence was known, they started comparing this with the other known viruses, and it was found that the sequence has about close to 80% similarity to the previously known SARS coronavirus. And so that's why it was called SARS coronavirus 2. So it is distinct from that. But interestingly, if you look at the nucleic acid sequence, which is about 29 to 36 kilobases of nucleic acids in this genome, and it has about 14 proteins which these encode. There is a very important protein called the spike protein. Of course, we hear a lot about the spike protein because this is the protein which is involved in binding of the virus to the host cell. Now, when we compare the spike protein of the SARS-CoV-2 with that of other coronaviruses, this is very unique. So there is if you remove the spike protein gene and compare the other genome between the old SARS-CoV and the present one, then the similarity goes up to more than 90%. So the major difference between the SARS-CoV, the earlier one, and the COVID-2 is in the spike protein, which is very unique, and that is also very important in causing infection. So why the earlier SARS did not become a big pandemic, and why this SARS-CoV, which is so closely related to that, is causing such a huge pandemic. This is because of the ability of this virus to cause this infection. So this spike protein is able to bind to our respiratory cells very efficiently, and then they merge the viral. Actually, it's not a cell, but it is enclosed in an envelope, so it merges with the host cell, and the RNA enters the host cell, and then the activity of the virus starts. The replication starts. So this is how this has become uh, highly transmissible. That's why you have found this becoming a pandemic. So the major difference between SARS and SARS-CoV-2 is in terms of some of the genes, particularly the spike protein, which SARS-CoV-2 has a very efficient spike protein, which has also led to some of the doubts now whether this is a natural virus or whether this has been modified. So now studies are going on to see whether there are elements of any introduced components in this spike protein. But spike protein appears to be the most important component in terms of ability to infect and cause disease in humans. So this is the major difference between SARS-CoV-2 and the previously known SARS viruses.
Okay, sir. As we, the common people, recognize the diseases by its symptoms, and so you can provide a note on the COVID-19 symptoms and what care and precaution should we take, and what exactly happens
Yeah.
in case of COVID-19 patients.
Yeah. Now, this COVID-19 infection occurs mainly through the respiratory route. So, it occurs through droplets. So, an infected person will shed the virus through secretions. It could be nasal secretions or through oral secretions. So, the secretions come out, say, when we breathe. So, normally, we may think that, okay, when we are normally breathing, there is nothing coming out of the nose. But if we hold a mirror near our nose, we will see that the mirror will become cloudy. You can see the moisture coming out there. So even when we breathe, there are small, tiny droplets coming out of the nose. And when we sneeze, of course, this is very forceful coming out of these droplets. And then when we cough, also these droplets come out. And even when we speak, so the transmission happens mainly through droplets coming out through the respiratory tract, either through the nose or through the oral cavity. And the virus starts replicating once it enters our respiratory system. It enters the epithelial cells and replicates there. And then it goes deeper. From the nose, it goes into the throat, and then goes into the lungs. So the initial symptoms may be, of course, one common thing which most people say is that they have a loss of smell and taste. Of course, this may be partly also due to the effect on the nervous system, but this is one of the earliest symptoms that some people observe. And then dry cough and fever. These are common in most affected people. They have these symptoms. and some may experience diarrhea, so gastrointestinal symptoms. And then once the infection goes to the lung, then it could become more serious because it can also affect the blood cells. So what we call as endothelial cells, which are lining the blood vessels, it can affect these cells, and then it can lead to also clotting and things like that. So this fusing of lung cells causes damage to the lungs, and then as the virus is progressing, we are responding through our own immune system. So the immune system sometimes, when it mounts very strongly, sometimes it may have a negative effect. So that's why we call this. There is a this thing. What is that? This spark of these type of immune molecules that are produced. So they once they affect the lungs, the immune system reacts, and that is the reason why you find people having difficulty in breathing. Then they need oxygen support, and then they need ventilator support. So that's why, of course, these molecules which are produced in the immune system are called, of course, cytokines. These are cell produced by our own cells, and this can become a storm if it becomes a very big reaction. So that is one of the reasons this is causing this failure of lungs, and then eventually there can be mortality also in a small percentage of people. But most common, so normally when we talk about symptoms, you can have asymptomatic. Of course, we need to also remember that not all people who are infected may show infection. Once the testing has expanded, now we know more and more that there are people who have absolutely no symptoms, but they test positive. So this is one stage where we call it asymptomatic stage. They may remain asymptomatic, or it may be a pre-symptomatic stage. So the one person who tested positive may show symptom after a few days. So it may be a pre-symptomatic stage. Or some people may remain throughout asymptomatic, even though they have tested positive, they don't show any symptoms at all. So asymptomatic stage is one stage. And then second stage is when you show mild symptoms, like you have fever, then you have a dry cough, but you have no major effect on the respiratory symptom, no difficulty in breathing. So actually the Director General of Health Services, they have come out now with guidelines. So they have classified these different groups. How do you classify? As mild, moderate, and severe. So in the case of mild infection, you have fever or cough, but your oxygen saturation. So one important thing we have to keep in mind is the oxygen saturation. And this oximeter, pulse oximeters are available, so people can monitor their oxygen saturation with this device at home. So if the oxygenation is above 94%, then you don't need to worry. So it remains a mild symptom. Now, if the oxygenation falls below 94%, then the person may go into a moderate stage where there is some difficulty in breathing, so the person may need some oxygen supplementation. So that will be a moderate stage, and then finally the severe stage where this becomes the symptoms, the respiratory difficulty becomes very severe, the oxygen rate falls, so then it becomes severe. So there are these three categories, but for I think what common person needs to remember is to monitor oxygen. So if they have fever, if they have a dry cough, then monitor oxygen. So as per the new guideline, so people who are having mild infections don't require hospitalization, but you need to isolate yourself at home because you can transmit to others at home. So at home, the person will have to be in a separate room with a separate toilet, and all the food should be served in the separate room so that others don't get infected. And everybody should follow this COVID etiquette of wearing a mask. And So home isolation is advised for mild cases. And another thing that is recommended for mild cases to watch out is about, it's called a 6-minute walk. So a person who is in home isolation can do a walk within the facility for 6 minutes and then monitor oxygen. So if there is a drop in oxygen, or if the difficulty in breathing increases, then of course there is a doubt that the person may be going into a moderate stage. So basically, people who are having symptoms, mild symptoms, can be isolated at home, but monitor oxygen, do a 6-minute test, and then if the oxygen level drops below 94%, then they have to seek medical attention in a hospital. It may be initially only oxygen support and medications depending on the severity of symptoms. So these guidelines have now come out from the Director General of Health Services. So many hospitals are following these guidelines.
Okay, sir. Now, these days, now are often listening that we are now being hit by the second wave of COVID-19 pandemic. Are there more waves coming in further days, and what that exactly means? And is the same SARS-CoV-2 causing the diseases, or it is something else?
Now, if we look at the history of pandemics, there was a pandemic in 1918 due to what we call a Spanish flu. So that was this pandemic which had a similar course like the present pandemic. So if you look at the how the pandemic progressed in 1918, you can see that there was some infection and what we call as a peak. So when we see the number of infections, they peak and they come down. So we always talk about flattening the curve. That means you have reached the peak and then it starts coming down. It may not come down immediately, it may come down slowly. That's why you say flattening the curve. So in epidemiology, we are talking about a peak, flattening the curve, and then the next wave. So if you look at the Spanish flu picture, you will see that there were 3 waves. The first wave was small, the second wave was bigger than the first wave, and then there was a third wave also. So in all major diseases, you could anticipate this kind of situation. That is what happened even in SARS-CoV-2. Not only in India, it happened in all countries, even in Europe and United States. So there have been more than one wave. So second wave, third wave, even fourth wave in some countries. So the disease happens in these kind of waves, because that means when we say wave, that means the number of cases increase, then the curve flattens and it starts coming down, and then again it increases. Of course, in India, we had a peak of about 100,000. We went to close to 100,000 cases a day. Then it started coming down, and it came down to almost 10,000 or even less per day. And then suddenly it started increasing, and we went up to nearly 400,000 cases. So the second wave was much bigger than the first wave, and the rise was also much steeper. But fortunately, the fall is also, we can see now the cases are coming down. So the curve is already on a downward progression. And we can never say whether there will be a third wave. Because, of course, the population, it all depends on the susceptibility of population and also the virus undergoing change. Now, as the virus infects more and more people, it also undergoes change. Particularly these RNA viruses, they mutate quickly. and they undergo change. And they, of course, I think this is one of the main things in biology. So all life forms want to survive. So how do they want to survive? So in the case of viruses, they can survive only if they can infect more and more people. So they are trying to do this. Of course, this is probably a theory of evolution. So the fittest will survive. So these viruses are trying to infect more and more people and survive by causing more and more infection. So they are trying to adapt to the human system and trying to see how they can cause better infections. The mutations are in such a way that infection or the transmissibility can increase so that they can infect more people and survive. So this is what is happening, and we see number of changes taking place, and the susceptibility of population also changes. Now, probably why we see these kind of two waves, and then we are anticipating also a third wave, is mainly because after the first wave, what happened was the vaccines came and we started immunization. So there again, there was some priority because we can't immunize 1.3 billion people all at the same time. So we have to prioritize. So the initial priority was healthcare workers who are directly in contact with patients who are encountering infection. So they are at a very high risk. So they were immunized first. And then came the elderly who are more susceptible compared to the younger people. So after this vaccination started, now what we are seeing during the second wave is a lot of younger people are being affected. This is because younger people are yet to get vaccine, so they are still susceptible to the infection. So the virus tries to find a susceptible host. So as they are trying to mutate, increase their chance of transmission, and find susceptible hosts who have not received the vaccine or who are not got infection early. That's why we see high number of infections among younger people who have not got even a single dose of vaccine. Now the vaccination coverage is improving, so the younger people are also receiving vaccine. Of course, more than 45 are receiving vaccine. And so far, of course, in all countries, the children were not vaccinated. So now there's a suspicion that, okay, as you are covering the vaccine for more and more younger people, then you have one more segment of the population, that is children who are not vaccinated. So they will still remain susceptible. So whether they could be infected during the third wave. So that's what it's being thought, and already preparations are on how to go about. Can you immunize the children? So this kind of work is going on. So the disease epidemiology always follows this wave pattern, and they are also undergoing change, and the pathogens are undergoing change, and humans are also, now we are adopting precautions. But then why we see this, if we look at our behavior also, COVID behavior between the two waves, uh, after the first wave, though vaccines were available, we were hearing of vaccine wastage and vaccine hesitancy. So people were not going to take the vaccine because the number of cases were coming down. They thought this is gone, now corona is gone, so why should we take the vaccine? So that was the thinking, and people were not going for vaccine. And so also, if we look at our behavior in terms of social distancing and masking, that also became too liberal. So people started neglecting. There were big gatherings taking place, big events taking place. So these large gatherings and COVID inappropriate behavior led to this second wave. Not only the susceptible population, but we were giving more opportunity for the virus to spread by having this quite inappropriate behavior. So that's why we see this second wave. So it is a combination of the virus undergoing change, the increase, the availability of susceptible population, and lack of precautions among the susceptible population because we are not wearing masks or going into groups or arranging big events, thousands of people gathering together. So all these have caused this second wave, also due to our own behavior. So this is what we need to avoid and take precautions all the time, even if we are vaccinated. So now we know that even vaccination is not a 100% guarantee that you will not get infection, because you will be protected against hospitalization and mortality, but infection can still happen in people who are vaccinated. So the COVID appropriate behavior, masking should still be there even after you get the vaccination. So we need to take these precautions all the time if we have to manage this pandemic and try to minimize the impact of this coronavirus in the society.
Yes, sir. Now the person, if he has infected with coronavirus, to take the vaccine, he must get 3 months of recovery. After 3 months of recovery, he must get vaccinated. What is the reason behind it, sir? Why we should give 3 months of gap before taking the vaccination?
Yeah, that if a person has been naturally infected, uh, the gap is 3 months. This is mainly because during a natural infection, you have the person has encountered the virus. It's almost like receiving one dose of vaccine. So the person has encountered the virus, and person's immune system has been activated. So the person is having immune system. So if you monitor the blood will have antibodies. So the person is having antibodies. So he is protected for some time. So what he basically needs is only a booster. So this booster can come after 3 months because the antibody titer will be there. Of course, now they say of course antibody titer can be even after 3 months. It can be longer. It can be even more than 6 months or 9 months. But as the time goes, it may come down. So in an epidemic where you are exposed, you need to get protected. So in such cases, an infected person is advised to take vaccine. And now, of course, it's coming out from more studies that it is sufficient if the previously infected person takes one dose of the vaccine because he's almost getting like a booster dose after 3 months. So this is because his immune system is already primed. What we call as the first dose is like a priming dose. So that means your immune system is being primed to this vaccine. So similarly, an infected person's immune system is already primed, is already have produced antibodies. So the antibodies are there. So in 3 months he is definitely protected. But then after that he needs protection. So that's why they are advised to take the vaccine after 3 months, so that it's almost like acting like a booster dose.
Okay, sir. Now, often we are currently used to the term variants. Can you briefly explain in simple terms that what are these and why are being formed and what it means to us, sir?
Yeah. Now, as I mentioned, this is an RNA virus, and RNA virus, as it passes through the host, it undergoes mutation. So, this is natural of all RNA viruses. Now, mutations have been happening in these RNA viruses for, we know that, because if you look at influenza is also due to an RNA virus. And there are many types of influenza viruses and they undergo change. So we need to take influenza vaccine every 6 months. And each time the vaccine is made for that season. So it's not for now, if one vaccine is available, it's not good for all seasons. It's because you need to see what mutants are causing the influenza in the previous season, and then they develop the vaccine. So every 6 months, the vaccines are changed to include the variants which are important and causing the disease, so that you are protecting the individual. So we know that RNA viruses undergo change. Similarly, SARS-CoV-2 also we are observing. So since the pandemic started, people have been sequencing genomes, and now, of course, I think several hundreds of thousands of genome sequences are available, and these are put in a public database, global influenza-related virus sharing site, which is called GISAID. So you can get global sequences there. So when people start comparing the sequence of the virus which caused the disease in Wuhan, where it started, and then it went to other countries, and so when they analyze the sequences, they find that there are some changes taking place. Now, some of these changes may not have any consequence. So sometimes what happens is that there may be some changes in the nucleotides which may not lead to any change in the protein. So that may not lead to any effect. But some changes will lead to some changes in the protein. So we need to keep monitoring what are the changes that are taking place and how it is impacting the virus. So, if, for example, if there is mutation in the spike protein, now I mentioned about the importance of spike protein in causing disease. So, if you look at the spike protein, if it undergoes changes, and if these changes are increasing the transmissibility or increasing the severity of disease, then this becomes important. So there are different terminologies used. Of course, you say when there is a change in the sequence, you call it a variant. It's not the original Wuhan virus, but it's a variant because there are some changes in the sequences. So when you keep monitoring these variants, then you may categorize them based on their importance in terms of disease. So basically now we have two or three groups of variants. We call them variants of interest. That means, of course, it is these variants could be important, but they have not yet shown importance in terms of disease transmissibility or infection virulence or in terms of neutralization by antibodies. So there is this thing protection against infection in the case of vaccinated people. So we don't know, but we need to monitor them. So these are called variants of interest. There are some variants which have demonstrated increased transmissibility or reduced neutralization. So these are variants which are grouped under variants of concern. So now, for example, in India, we call it, of course, now recently WHO has said the classification terminology. Earlier, they used to call it, because it's all called with B1.1.7, then B1.6, and so on. So this is a little bit complicated. So now WHO has come out with the nomenclature, and also another way people used to call these viruses is based on where it was first isolated. For example, UK variant, Brazil variant, Indian variant, US variant, like that. But now there is a concern about use of this terminology because then they may say, okay, India has spread this, or Brazil has spread this, or UK has spread this. But it has been happening. So now we call them as alpha, beta, gamma, delta, and so on. So this, what we used to earlier call as UK variant, is now alpha group. So it has some changes in the spike protein, and these changes may cause some increased transmissibility. The Indian, what we find in India now, is now the Delta variant. And this Delta variant, now a lot of studies are coming out that it is showing 65% more transmissibility compared to the Alpha variant. So it can cause more infection in more people compared to the earlier virus. So its transmissibility has increased. We still don't know whether the disease severity is more because we still don't have data on that, whether hospitalizations are more or whether it's leading to higher mortality. we don't have data. But we have data to show that it transmissibility is higher. So even in UK now they are observing this Delta variant, and in household they have found higher transmission due to this Delta variant. Of course, in India now that is turning out to be the dominant variety, which is causing the infection during the second wave. So these variations or mutations have been happening, and some of them have consequence, some of them don't have consequence. So those which have consequence in terms of transmissibility or virulence or response to vaccines, so these are important, so they should be monitored. So they have been classified as variants of interest or concern. So these are now there on the WHO side, on the CDC side, and the European Center for Disease Control. So we have information on what are exactly the mutations occurring in these. Most of them are related to spike protein. There are also other mutations associated with this, but they confer certain ability to these viruses. So that's why they need to be monitored. And but of course, even if you have these variants, in terms of common man, the behavior, COVID behavior is same. So wearing a mask or wearing a face shield, keeping distance, these are same irrespective of whether it is alpha variant or delta variant. So from common man point of view, we need to observe the same precautions, washing hands, and so these type of precautions will have to be followed. But why we need to follow is to see whether these variants cause infection in vaccinated people. Because even though we follow these precautions, some infections may take place, and whether these variants are causing more infection, so that will cause a concern. So that's why we need to see whether these variants are causing more infection in vaccinated people. Now studies are going on. But we don't have clear data to show whether there are more infections due to a variant. But it's a normal process which is taking place, and some of them are showing higher transmissibility, like the Delta variant, which is now dominating in India.
Yes, sir. Finally, coming up, we have several vaccines coming up with the efforts of identifying several drugs are underway. So, in future, where do you think all this add up, sir?
Yeah, now because now see we this is a pandemic which has affected almost every country. So the global population is 7 billion. So we have to vaccinate 7 billion people. In India, of course, we have 1.3 billion people. So we need lots and lots of vaccines. So and one vaccine cannot meet all the demand, global demand. So as soon as this became a pandemic, all these vaccine producing companies have been working on developing vaccines. So there are different types of vaccines. In India, right now we have two vaccines, Covaxin and Covishield, one based on the killed virus technology, other based on adenovirus carrying the spike protein gene. And then now as studies are going on, the data shows that these vaccines are inducing protection. Antibodies are being formed, and they are also checking whether these antibodies are able to neutralize the virus. So now the studies show that the antibodies formed are able to neutralize the virus, and uh, both the Covaxin and Covishield, they are able to neutralize the virus in the cell cultures. So that is the first study about these viruses to see whether they are effective against the viruses. Now, the next stage of information that we need is to see whether these are effective in the field. So when we give the vaccine, are the vaccinated people protected? Now studies are coming on this. Data is accumulating, and early on, the Indian Council of Medical Research said that the rate of infection in vaccinated individuals is small. It is less than 1% in the normal population. But now more and more studies are coming. Recently, there have been some studies from in Delhi and also from CMC Vellore, particularly in healthcare people. Now, they studied healthcare people who have been vaccinated, those who have received a single dose of vaccine, and those who have received both the doses of vaccine. So the data shows that in people who have received only one dose, maybe they are the infection rate could be higher. They are, in fact, maybe 33% only is the protection. People who have received both the doses, the infection rate may be about 9 to 11% of people are infected. So this is higher than what ICMR reported earlier for the general population. There can be two reasons. Now, of course, healthcare people are exposed more, so they are mostly doctors and nurses who are in direct contact with patients. So they may be in contact with either asymptomatic people or infected people. So they show higher rate of infection. But the good thing is that even though they have infection, very few of them, very small percentage, require hospitalization, and there have been no deaths except in people who had other comorbidities. So, vaccine now, what the data comes out is that vaccination gives protection, and it does not totally rule out infection, because infection normally vaccinations cannot rule out infections, but it will protect against disease, so disease becoming severe. So vaccinated people may have mild infection or asymptomatic infection, uh, but it prevents hospitalization and mortality. So now this type of data is coming from many countries. So the vaccines that are currently available seem to be effective. So what we need to do is increase the vaccine coverage. Now, of course, as more people are becoming eligible to get vaccination, and the second wave came, so lots of people are now interested in going for vaccine. So now we have almost vaccine desperation. So that means people are desperate to get a vaccine. Earlier we had a vaccine hesitancy, but now, of course, people say, okay, there is shortage. But now we have opened up, so we need more vaccines. And now probably other vaccines are also coming to India. Sputnik vaccine from Russia is in the process of approval. There is also adenovirus-based vaccine like the AstraZeneca vaccine or the Covishield, but it uses two adenoviruses for the two doses. The first dose is with one adenovirus. The second dose is with a different adenovirus. So this is another technology, and then Novavax is also expected to come to India. So there are also negotiations going on with this import of vaccine. So I think what is important is to get vaccinated, but also follow COVID appropriate behavior. So don't, even if you are vaccinated, don't forget to still take precautions, wear a mask, and keep distance. So we need to follow these precautions, because we now know that vaccination is not 100% protection. So we don't know what are the new variants that will come up and what is their impact on disease. So we need to be vigilant all the time and take vaccination and follow good hygiene practices and masking and keeping distance. So I think if we follow that, we can minimize the impact of this pandemic to a large extent.
Thank you, sir. I think so far we have covered most of the topics about COVID-19 symptoms, SARS-CoV-2 variants, etc. Thank you so much, sir, for being a part of this session, and thank you for accepting our invitation. Thank you so much.
Yeah, thank you.